we're going to go ahead and get started. Greetings. Welcome. Welcome to the Power of Youth Voices. My name is Callie Simon, and I am the Youth Lead for Momentum Country and Global Leadership. We are so thrilled to be here with you today to hear how youth are holding their health systems accountable for meeting their sexual and reproductive health and rights. A few logistical notes before we jump in. Today's event will be in English with live interpretation into French available. To access interpretation, please click on the globe icon at the bottom of your screen and select French, as you can see here on the slide. Angela?
Pour écouter le webinaire en français, vous pouvez cliquer sur l'icône du globe en bas de votre écran et sélectionner Français.
Thank you. You will see that the chat is closed for security purposes. Please share your comments and questions through Zoom's question and answer feature or function. We will answer as many questions as we can as they come in during the presentation, and then we will be sure to save some questions for the question and answer period that we will have at the end of the webinar. The presentations and full recording of the event will be available to all who registered after the event. Now, without further ado, I'd like to introduce my colleague, Katie Meyer, who is an adolescent and youth SRH advisor on our Momentum Country and Global Leadership team. She'll provide some brief background on the youth social accountability work that we're talking about today, and pass to Maggie and Hajay from our youth partners, YSD and Yarrow, who will provide the details of their work and the rich learning to date. Over to you, Katie.
Thanks so much, Kelly. As she mentioned, I'm just going to be briefly introducing what youth-led social accountability is, specifically what is youth-led social accountability for health. So let's dive right in. Next slide. Youth-led social accountability for health is when youth hold different public officials and service providers accountable to the services and protections they're receiving. Some of these include their access to quality, equitable, and accessible health care, but it also includes health education and other protection schemes. Next slide. So our activity, Momentum Country and Global Leadership, is really aiming to strengthen the capacity of youth-led and youth-serving partners so that we can advance and really accelerate youth-led social accountability work and contribute to the evidence base. Building off of Momentum Country and Global Leadership's landscape analysis that we conducted in 2021, we decided to partner with two youth-led organizations, one in Kenya and one in Ghana, and we're supporting these partners to implement youth-led social accountability and also to document the learnings along the way, the data and outcomes, as well as provide organizational and technical assistance to the needs identified. Next slide. So why are we implementing youth-led social accountability for health? There are a number of potential gains. A few of those are highlighted on the screen. Youth-led social accountability can contribute to adolescent responsive health systems. It can improve the quality of services and programming for youth. It can foster positive youth development and leadership, and it can meaningfully engage youth in a systematic and sustainable way to advance their health and their human rights. Now, despite all of these value adds that we just said, there is limited documentation and systematic learning about youth-led social accountability, which was flagged in our landscape analysis. So in the next slide, we'll show you how our activity is really helping to address some of those gaps. So through this learning and implementation, Momentum is aiming to answer a few critical learning questions. The first being, what are the factors that are helping or hindering youth participation in social accountability mechanisms for health? How is youth-led social accountability contributing to positive youth development, if at all? How is it contributing to quality of health services and responsiveness of the health system to those needs of adolescents and youth, if at all? And finally, what are the types of capacity development services that are most effective in supporting youth-led organizations to improve their performance? So really, this activity is a lot about documentation of activities and our learning along the way. Now, I'm not going to take any more time. We'll get over to the part of the presentation that you're all here for, which is to hear from our youth partners, youth advocacy on rights and opportunities in Ghana, and youth for sustainable development in Kenya. So I'm going to pass the microphone over to Maggie and Haji to introduce themselves and their organizations.
Hello, everyone. It's nice to be here. My name is Margaret Wanja, the Business Development Manager at Youth for Sustainable Development, Machakos Chapter. Over to you, Haji.
Hello, nice to be here. My name is Benin Haji, the Director for Youth Advocacy on Rights and Opportunities, YARO, in Ghana. YARO is a youth serving organization that aims to promote the well-being of women and the rights of youth and children in northern Ghana through the design and implementation of innovative and culturally sensitive development interventions that meet the needs of our target youth.
Why is the youth-led organization that strives to promote and champion inclusive approaches to youth empowerment through youth participation and social accountability in Machakos County, Kenya? Haji, over to the next slide.
As you can see on your screen, together with MCGL, YARO, and YSD, we co-designed this activity and partnership, while each of our organizations have slightly different activities. We follow the same overall approach and theory of change. MCGL adapted this activity social accountability framework from Jonathan Fox. This model breaks down the different levels of engagement from young people and duty bearers for social accountability to be responsive to the needs of adolescents and youth. Each of these levels have associated activities that MCGL, YARO, and YSD decided on together in the co-creation process. For our ES, these are activities that ensure youth are aware of their SRH rights and entitlements. Maggie just highlighted a few of those with the awareness raising sessions and events with young people and duty bearers. For the voice, these are activities that enable youth to be able to voice their concerns and dialogue with authorities. The community scorecard and assessments are an example of one of the main activities under voice. For our teeth, these are activities that support authorities in responding to young people's concerns. These include dialogue and follow-ups. Our theory of change demonstrates that with appropriate inputs and resources, these three levels of engagement, as well as support for collaboration, learning, and adoption and capacity development of our youth-led social accountability, and that can contribute to one, improve knowledge, skills, confidence on SRH rights and entitlement of young people. That will also increase youth participation in and leading social accountability activities. That will also improve quality of SRH services according to scorecards, scores, and also increase support for youth-led social accountability. These short to medium-term outcomes aim to ultimately improve positive youth development and increase youth responsiveness of the health system. We will further describe these activities of our organizations
So it looks like Haji's audio may have dipped out for a moment.
that have completed and have received, that has already resulted in activities. Over to you, Maggie.
Thank you so much, Haji. A major emphasis of this project was documenting the process of implementing the youth-led social accountability, as well as learnings and adaptations along the way through several collaborating learning and adaptation exercises. And one of these exercises was the learning calls, which was done, we conducted monthly. It was a pause and reflective sessions where which used an implementation tracking tool to monitor project adaptations and understand the implementation process. The other exercise was the net mapping exercise, which we conducted at the beginning and at the end of the project. The net mapping exercise was used with various stakeholder groups, young people, community leaders, and government authorities, opinion leaders, etc., to examine the operating environment of youth-led social accountability. The other exercise was the most significant change, which was also conducted at the beginning and at the end of the project, and helped us to understand if it had achieved progress related to the 4 domains of positive youth development and at what levels of engagement. Finally, we conducted after-action reviews at the beginning and at the end of the project, and we used the after-action reviews with the various stakeholders, as mentioned, the young people, community members, and government authorities, to collect information on activity implementation, including lessons learned and impact. Next slide. So we had different activities in the youth social accountability work. In Yaro, Ghana, they conducted awareness activities with stakeholders using drama club meetings, mommy and daddy club meetings, radio, youth debates, and networking conferences. We worked in 6 facilities in 4 districts in northern Ghana to conduct assessments, generate action plans, and support progress of identified gaps. So this included 1 rural facilities, 4 urban facilities, and 11 peri-urban facilities. In Kenya, YSD, we conducted awareness activities with stakeholders using education sessions, online campaigns, and different workshops. We worked in 20 facilities in 4 sub-counties of Machakos County, conduct assessments, generate action plans, and support progress of identified gaps. These facilities included 10 rural facilities, 3 urban facilities, and 4 peri-urban facilities. Next slide. We are now going to discuss the outcomes and achievements from youth-led social accountability in Ghana and Kenya. And I'm going to pass it over to my brother Haji from Ghana to take it up on the outputs from Ghana.
Thank you very much, Maggie. As you can see on the screen, the project under Yaro reached out to more than 1,400 people in community scorecard processes. About 54% were adolescents and youth. More than 34,000 people were reached out to with awareness raising and sessions through radio broadcast, and more than 100 learning activities were carried out. We will explain this in details as we move on to the next slides that looks at our community scorecard results. Next slide. For the indicators we used are on the screen, and we measured these from baseline to end line for all our facilities. For example, some facilities also conducted midline assessments. The youth social accountability activity achieved results with all 36 facilities, showing improvement in all 5 indicators from baseline to end line. You can see the indicators that all 36 facilities used for their community scorecards assessment. Through these indicators, Though these indicators are the same, the issues raised and the prioritization of certain actions items in response to those indicators is different based on the stakeholders and community of facilities. The stakeholders, young people, health workers, community members, chose to rate indicators using the Likert scale from 1 to 5, and 1 being the very poor, 2 being poor, 3 being just okay, 4 being okay, and 5 being very good. The scores are an average of the scores from all 3 stakeholder groups. Additionally, for the facilities that we conducted midline assessments in, we were able to use that information to make changes to our programming to address these issues where possible. Next slide. While we wish we had time to go all over the impressive community scorecard results, we are going to show 2 indicators across the 4 districts, which we average for baseline and endline scores for each district. Within each district, 8 to 10 facilities were assessed from baseline to endline. You can see the number of facilities in each of the districts in parentheses as shown in our slides. As a reminder, indicator 1 looks at if reproductive health services are available for young people when they visit, and if the nurses are very harsh on young people or make young people ashamed. You can see across all 4 districts, the availability and treatment of health personnel for adolescents assessing sexual and reproductive health services improved within less than 2 years. At baseline, Yaro heard from different stakeholders that nurses were harsh in their treatment towards young people, and that young people felt ashamed going to health facilities for SRH services. At endline, Yaro documented that Ghana Health Service staff are now very responsive to the needs of adolescents and youth visiting the health facility as a result of this collaboration between Yaro and Ghana Health Services. Next slide. Indicator 3 looked at the level of stigma towards young people assessing family planning and reproductive health. In all 4 districts, the stigma towards young people visiting the health facility for sexual and reproductive health services was reduced from baseline to endline, improving the experience of young people visiting the health facility. At baseline, different stakeholders told Yaro about the high level of stigma towards young people visiting their health facility for sexual and reproductive health services. At endline, Yaro noted that mommy and daddy club sessions, along other education sessions, and the use of youth volunteers to educate young people have helped to improve acceptance and accessibility of sexual and reproductive health services for young people. Over to you, Maggie.
Thank you, Hadji. We're now going to look at the outputs from Kenya. Next slide. So we had 100% get activities met and actually exceeded the activities that we were supposed to conduct. We engaged more than 3,100 people over the course of the activities. And among these 3,100 people, we engaged 700 people in the community scorecard process, and 45% of these people were adolescents and young people. More than 2,000 people were engaged during the awareness raising sessions and 100 more in the learning exercises. As mentioned before, we also conducted 20 facility assessments, and 43 young people, volunteers, and YSD staff were trained on the community scorecard process. We conducted 40 follow-up meetings held after the community scorecards to follow up on the action plans, and we conducted 6 learning exercises over the period of 2 years. We'll dive deeper into community scorecard results in the next few slides. Next slide. So some of the outcomes from Kenya. The key achievements from Kenya on the community scorecard results. YSD conducted repeated assessments from the original 16 facilities in a sample of 5 facilities, examining changes at baseline, midline, and endline. For the 4 facilities expanded in 2022, YSD examined changes at baseline and endline. Some of the examples of indicators are provided on your screen. Baseline to endline results across all 9 facilities showed improvements across all indicators assessed. Facility created their own set of 3 to 5 indicators based on the prioritized issues agreed upon by the 3 stakeholder groups in that community. Some indicators were similar across facilities, but not facilities share the exact same set of indicators. Thus, comparison across facilities was a bit difficult. Instead of showing you comparisons between facilities, we will be presenting scores from 2 facilities, one from our initial facilities we supported and one from the facilities we added during the scale-up of the activities. The stakeholder groups that we chose were young people, health workers, and community members, and they chose to rate indicators using the scale 1 to 5, as Hadri described, 1 being very poor and 5 being very good. The scores are then averaged across the 3 stakeholder groups for a combined score. You will see from the facilities that we conducted midline assessments in, we were able to use that information to make changes to our programming to address issues where possible. While we would love to show you all the results from the 9 facilities, we'll only go through 2 facilities. The largest level 5 and one of the expanded, which is a level 3. So as you can see on your screen, we will begin by showing you the results from the only level 5 facilities we assessed in the country. And we looked at the following indicators for the assessment. You will see we have shortened their name on the graph, but from baseline to midline to endline, scores improved across 3 indicators, with the 4th indicator showing a slight decrease. For this indicator on feedback mechanism, participants agreed that there is a need to intensify awareness creation on the importance of providing feedback to young people and the rest of the community members as well. Next slide. So on your screen, the results from the Momando level 3 facility, and this one was one of the facilities that we expanded in 2022, and again we have shortened the indicator name on the graph. The facility looked at the following indicators for the assessment. From baseline to endline, the scores improved across all 5 facilities. You will see a particular increase in indicator 1 regarding the availability of sexual reproductive health commodities. During follow-up sessions, YSD and health workers discussed the process of procurement and securing sexual reproductive health commodities, which helped clear up confusion on why certain commodities were low, particularly for commodities young people requested more oftenly, like condoms and contraception and the rest. Next slide. We are now going to discuss the challenges and adaptations from youth-led social accountability projects, both in Ghana and Kenya. Next slide. As noted earlier, we used several different learning methods, which allowed us to reflect and adjust our activities along the way to better meet the needs of adolescents and youth we are working with. We had many challenges along the way implementing this activity, and wanted to highlight what some of those challenges were, the actions we took to address them, the results we achieved from those adaptations. Over to you, Haji.
Thank you very much, Maggie. One of the challenges we faced was that some stakeholders did not trust that youth-led organizations would be able to lead successful initiatives. The action we took to address this was that both youth-led organizations involved a wide range of stakeholders and maintained continuous engagement to show progress in their work. This began first with the inception and community entry activities. But the net mapping exercise also helped both of our organizations to engage all the actors involved in youth participation in social accountability. The result that we achieved under this was that these different levels of engagement and involvement of all types of duty bearers resulted in our organizations building trust and buy-in for the activity, as well as involving a wide range of stakeholders throughout the process, which allowed and involving a wide range of stakeholders throughout the process and different duty bearers to see our work from start to finish. The key decision makers noted that they were impressed by the quality and consistency of both our organization's work. Maggie, come in.
Another challenge we faced in both countries was that young people felt that their voice was not heard by the decision makers, and action that we took, the activity empowered young people to speak with one voice during meetings with community leaders and government representatives. Holding separate meetings first helped the young people participate, agree on their message, and feel more confident when interacting with other stakeholders. This resulted in other stakeholders who were more inclined to take into account young people's opinions when they spoke as a group. And they got confidence into interacting with the duty bearers and the community members as well. Ajay, to you.
Thank you, Maggie. We also wanted to highlight was that it was difficult to follow all the action items from each facility. Some facilities had trouble maintaining momentum for some of their actions. The actions that we took was to physically post the action items in front of each facility following dialogue and follow-up meetings. This increased accountability of healthcare staff and community members. Maggie?
And lastly, we both faced challenges with scheduling meetings with healthcare providers who felt overburdened by the number of meetings and the level of efforts required to implement actions in the course of the project, as they were not used to answering to young people requests. So the action we took, we initially scheduled monthly follow-up meetings and then adjusted the frequency based on progress. We advanced phone calls, which helped us in determining whether follow-up meetings were appropriate instead of just visiting the facility. And this resulted in healthcare providers feeling supported through the process without feeling overwhelmed and pressured during the whole process. Next slide. So we're now going to discuss the contributions to positive youth development. Next slide. We will be presenting the key achievements on positive youth across both countries. Positive youth development is a framework for achieving the vision of healthy, productive, and engaged youth. The framework illustrates how positive youth development programs, practices, and policies must work together with youth to improve the assets, agency, contributions, and enabling environment. For more information on the positive youth development framework, we have included the link in the chat, so look out for that. Next slide. Now we will provide some more progress achieved from the youth-led social accountability activity towards positive youth development. Looking first at the assets, young people were able to build competencies and confidence to advocate for their own sexual reproductive health service quality and access as a result of this activity. Young people who engage in this activity across both countries build two types of skills, competencies and confidence, to speak with government entities and make their voice heard, and knowledge on sexual reproductive health, as well as available services. Young volunteers also built their facilitation and presentation skills through regular training and practice. For example, training in community scorecard facilitation, presentations during international conference and webinars that we have been part of throughout the process of the project. Having the opportunity to sit with government representatives, the Ministry of Health in Kenya and Ghana Health Services and other stakeholders was a first-time experience for many young volunteers. It helped them to gain confidence, and even their body language changed during all this communication. So as you can see on your screen, there's a nice quote from a youth participant in Kenya who I quote, when you are informed, you discover your value, you discover your purpose in life, and you are able to make informed choices. Next slide. So the next domain is agency. In this domain, the activity contributed towards young people's ability to use their assets to make their own decision and act upon those decisions. Young people engaged in the activity were able to use their assets to make their own decisions and act upon those decisions. This was noticeable in their presentation and facilitation skills, the ability to assess sexual reproductive health services, and their capacity to share information. Young volunteers were able to use their presentation skills to make their voices heard during dialogue and follow-up meetings with governments and community leaders. Also, on your screen, you can see a quote from a healthcare provider who mentioned, as I quote, "Now young people know that they do not have to be married in order to access these services, and they do not have to be afraid of being stigmatized about sexual and reproductive health services or issues." Sorry. Next slide.
Thank you. Yes, thank
Over
you
to
very
you.
much, Maggie. In this domain, as you can see on your screen, in the domain of contribution, our activity helped young people feel that they were able to have a positive impact on their own health, on their peers, and on their communities. In this domain, the activity contributed towards young people's ability to use their assets to make their own decision and act upon those decisions. Through awareness raising sessions and the community scorecard processes, young volunteers were engaged in creating a more supportive environment around them. Young people were also able to report the feeling that they had more influence on health decision makers and that their opinions were heard. As you can read a quote from a young volunteer from Ghana, I have been able to also add my voice, making sure that I used our platforms, I engage in to share the problems or the issue that I have learned. And I also to keep referring to people because we need to give them quality information and then tell them where you can get the direct services from to assist them when it comes to reproductive health, unquote. A volunteer from Ghana. Next slide. Lastly, in the domain of enabling environment, the activity created a more supportive environment for young people through different stakeholder engagement, including health workers, community and religious leaders, and community members. The activity created a more supportive environment for young people in many ways, among healthcare providers, community and religious leaders, parents, and community members in general. Healthcare providers reported that the community scorecard process made them more aware of adolescents and youth needs. As a result, they were able to provide youth-friendly services that could easily be accessed by adolescents and youth. Discussions around youth sexual reproductive health rights led to reduced stigma among service providers and community members. And I read a quote from an opinion leader in Ghana, quote, "The knowledge gained from the program has been very helpful. I have been able to use it to guide my children," unquote. A quote from an opinion leader from Ghana. Over to you, Maggie. Next slide.
We are now going to present some of the learnings and future opportunities from the youth-led social accountability in Ghana and Kenya. So next slide. So we're going to look at the reflections on the partnerships with the youth-led organizations and the global project. So key takeaways from our project was that this activity is the value add of young partners in youth social accountability space. This includes several aspects. So first, having youth partners in the youth social accountability work gives youth the opportunity to drive change according to what young people want and need. It builds, for example, in YSD, it builds the YSD staff and young people's assets and skills within the community and broader health system. The community building support we received enhanced the existing leadership training we provide to our young volunteers, which includes communication skills, conflict resolution skills, diversity and inclusion, and a growth mindset. It also empowered young volunteers to speak up during events and feel confident in their ability to demand change. And having youth-led organizations in this space also changed norms and inequalities between young people and adults. At times, we face challenges with power dynamics between young people and different stakeholders. For example, community leaders and some of the Ministry of Health staff at the start of the project made assumptions about what youth could do in social accountability work. It was important for us to explain to them how youth can lead these processes and why they should be involved and at the center of the whole process. Over to you.
Thank you very much, Maggie. Having youth partners in youth social accountability work also bring perspectives and voice of youth to conversation and decision making. This ensures that the unique needs of young people are well represented and the duty bearers are held accountable. This activity empowered young people to speak with one voice during meetings with community leaders and government representatives. YARO held separate meetings in first with young people to help young participants agree to their message and feel more confident when interacting with other stakeholders. This resulted in other stakeholders being inclined to take young people's opinions seriously when they spoke as a group. The next reflection we have from this activity is that direct and separate capacity development support and financing are critical from the start of the award. MCGL provided funding and key areas that need support, which allowed our organizations to grow and thrive within this activity. For example, MCGL demonstrated the need for regularly monitoring and discussing program results, even those that are not direct deliverable outputs or outcomes. During one of these discussions with MCGL, we discussed some potential reasons why one district was doing much better with mommy and daddy group discussions. We talked about how in that district we had separated the women initially in mommy and daddy club meetings. This was an effective strategy for creating an open atmosphere for women to share their feelings towards their children accessing SRH services. Then, once we brought parents together, the women were better able to share their experiences, ideas, and perspectives By discussing this strategy further, we were able to repeat this strategy for other districts, which helped move discussions quicker and more efficiently. Maggie.
Thank you, Haji. The reflection that we're going to talk about is the tailored mentorship and technical assistance that was produced during the that produced quality results in the process of the project. We're going to discuss and dive deeper into this during the question and answer session if there's time. But this activity generally has provided lots of documentation on what has worked well, but also gave us time to reflect on what could be improved. And we will discuss more going forward. Next slide. Haji, over to you.
Thank you, Maggie. In conclusion, promoting partnership with youth-led organizations for social accountability work with Ministry of Health, USAID, and other partners, we're saying that this activity shows the value of working and engaging with youth-led organizations for social accountability work. In relatively short amount of time, Yarrow and YSD have been able to produce impressive results, both in terms of contribution to positive youth development and to the overall responsiveness of the health systems to adolescent and youth needs. USAID, Ministry of Health, and other youth-serving organizations should give a chance to grow and showcase our skills, as well as provide opportunities to contribute to health activities and health systems. The way forward. Next slide. Over to you, Maggie.
All right. As we come to conclusion, we have way forward. We recommend using a similar model to what Momentum used with our organizations, providing tailored mentorship, capacity development funding, and support for learning throughout the activity. However, we have some areas we recommend examining to improve partnerships. We experienced some operating barriers through working with Momentum that could be addressed and improved for future partnerships with youth-led organizations. These include one, contractual obligations. Some of the contractual obligations required a very short turnaround. The requirements changed throughout the development of the award agreements. It will have been helpful to have a straightforward guidance at the start of developing the agreement, as well as more respectful deadline expectation. The other one is the cash flow. With being a small organization or having small organization, it was difficult for activities to initiate without funding provided quickly at the start. While our agreement allowed for a larger portion of the funds to be disbursed at the start of the project, receiving the funds sometimes took substantial time, which created stress for our staff and delays to activities. Haji, over to you.
Thank you, Maggie. Relationship building with stakeholders takes time, and partners should ensure youth social accountability projects have ample time to implement and demonstrate progress. Yarrow already has a great relationship with Ghana Health Service, but still needed to invest more time to help Ghana Service understand the value of youth involvement in social accountability. This has ultimately ensured our success in implementing the work, but requires a lot of time for the activity implementation period. Maggie.
And thank you so much, Haji. That closes our portion of our presentation. Thank you so much for listening. Over to you, Kate.
Thank you so much, Maggie and Haji. What a wonderful presentation. I want to quickly pass to Corey Warnell, the Youth and Reproductive Health Advisor at USAID, who has been a huge supporter and co-conspirator in this activity. We're so grateful to have you, and we look forward to some reflections from you.
Great. Thank you, Callie. And thank you so much, Maggie and Haji, not only for this wonderful presentation, but for the great work YSD and Yarrow are doing for and with your communities. Also, thank you to the Momentum Country and Global Leadership Project for your commitment to increasing the capacity of youth-led organizations, increasing communities' ability to demand the healthcare they deserve, and increasing the voices of youth so they may grow and contribute to the betterment of their communities. In 2012, USAID became the first donor of its size to release a youth and development policy, solidifying its commitment to and focus on adolescents and young adults. Last year, youth advisors from across the agency updated this policy, making it more robust and putting a decade's worth of learning and growth into the next generation of USAID programming. The updated policy indicates two pieces that are relevant to today's conversation: the inclusion of positive youth development, or PYD, as the approach and philosophy for youth programming across USAID, and a call for increased youth-led activities and programming. I focus on these two pieces because they are what help to put power into the hands of young people to direct their own lives. Through PYD, young people are supported to acknowledge their strengths and learn new talents while they are empowered to apply what they've learned. Through a PYD approach, young people are encouraged to contribute to their communities, reminding both young and old of how vital youth are to their communities and the development and prosperity of their countries. You may have noticed during the earlier explanation of PYD that the domain with the most features is helping to create an enabling environment, a task that is often thought of as something older people do with other older people. However, through youth-led social accountability, young people have the ability, the space, and the voice to create their own enabling environment and to shape their world into the kind of place where they want to live, grow older, and raise their children. Or not, because part of living in an enabling environment means all people, including young people, get to choose whether or not to have children, how many to have, and the timing for having children. Through social accountability mechanisms, youth have structured, systematic, methodical means to ensure they are able to shape health systems to fit their needs and allow for them to make autonomous decisions. Under the leadership of Administrator Samantha Power, USAID has placed localization at the center of its programming. USAID defines localization as the set of internal reforms, actions, and behavior changes needed to ensure the agency's work puts local actors in the lead, strengthens local systems, and is responsive to local communities. Informed by over a decade of experience, there are 4 lines of effort critical to localization. 1, adapting policies and programs to foster locally led development, including through local capacity strengthening. 2, shifting power to local actors, including those from marginalized and underrepresented groups like youth, and promoting space for them to influence and exercise leadership. 3, channeling a larger proportion of funding directly to local partners. And 4, serving as a global advocate and thought leader to catalyze a broader shift toward local-led development. Bringing these 3 USAID priorities together, positive youth development, youth-led activities and programming, and localization, sets a path for how we in the development sector can move forward together. As USAID continues to analyze and restructure internal processes which may be burdensome for some organizations to navigate, new opportunities for local organizations to partner with the agency become available. And we, the youth advisors of USAID, continue to advocate and find paths for youth-led and youth-serving organizations to take advantage of those opportunities. As youth-led social accountability moves forward, recognizing the wide variety of tools and methods available for use in bringing communities, stakeholders, and duty bearers together will be invaluable. While community scorecards are an effective method, YLOs are encouraged to consider and become familiar with other methods for social accountability. In some cases, other methods are needed to support the scorecards, while others may be more suitable for the situation. Reach out to the community of social accountability practitioners for support where needed. Also, please develop a dissemination plan before the community dialogues ever begin. Momentum Country and Global Leadership conducted research that found a lack of documented youth-led social accountability activities, though there were indications this work was being conducted. While documentation does not need to be as formal as peer-reviewed journal articles, by documenting youth-led social accountability, young people have tailored guidelines, lessons learned, and the encouragement that it can be done by people their age. This is vital to the future of youth-led social accountability. Again, I want to thank Momentum Country and Global Leadership for their dedication to and support for youth-led organizations. I also thank them for today's webinar and giving me the chance to champion this most amazing work. I very much thank Maggie and Haji for the work they are doing with YSD and Yarrow in their communities. And I also want to thank them for being here today as living examples to others of what can be done by young people who want to make a difference in their communities. And finally, I want to thank all of you participants who have joined today's webinar with the hope of learning what you can do to improve your own communities. I hope what you've heard has inspired you and sparked your interest in working with your own health systems in order for all young people to have the family planning and sexual reproductive health information and services they have a right to demand. Thank you. Over to you, Katie.
Thank you so much, Corey. And we are now to our question and answer portion of our webinar. So thank you all for submitting such great questions. We have several that we're going to try to answer. So I will ask first for Maggie to answer a question from Beverly. And she asked, sorry, I thought I had that pulled up. Yes. What interventions were most successful and made the greatest impact on achieving the goals of the activity?
Thank you so much for that question. I think the intervention that was most successful that helped us to achieve the greatest impact was the capacity building on youth-led social accountability, the training for our youth champions and youth volunteers in the community to enable communities to sit together during community scorecard sessions and discuss gaps around the facilities on sexual reproductive health and family planning for young people. Through this capacity building, we were able to develop action plans and were able to dialogue on how best young people, health workers, and community can come together to bridge these gaps and provide the best services for the young people. I think that for me was the best intervention in the whole process because it brought out great achievements. Yeah.
Thanks so much, Maggie. And Haji, could you answer just in maybe a minute? What were the interventions that were most successful and had the greatest impact?
Thank you very much, Kathy. The interventions that were most successful, I think, has to do with the collaborative meetings between Ghana Health Service, parents, and young people. Building this synergy between young people and stakeholders through our net mapping conferences and district level conferencing give young people the ability to build strong partnership, feel free to state their cases, and to reduce stigma at all levels. Thank you.
Thanks so much, Haji. And I'm going to go right back to you, Haji. What do you feel like were some of the mentorship and capacity development support that you received from Momentum that really stands out, that has had a lasting impact on your organization?
Yes, thank you very much, Katie. The householding I will want to choose. We had a lot of learning calls with MCGL at the end of every month, sharing ideas and addressing critical issues that come up which needs immediate attention. We also received a lot of capacity building from MCGL partner, PAC, and together, the learning calls, training from PAC helped YARO to position itself as a very prominent youth organization that is setting the pace for other young organizations that have youth-focused, youth-led to learn from. Thank you.
Thanks, Haji. And the same question to you, Maggie. How has this mentorship and coaching and capacity development affected your organization beyond this activity?
On top of what Haji has talked about, the collaborative learning and adapting, for us as YSD, we have been able to develop our systems, organizational systems, as a small organization, which somehow were invisible in the community. We once attended a meeting at the Ministry of Health, and they asked us, so what do you have to offer? And we went back and we built our systems, and now we are able to dialogue with the Ministry of Health. They're able to identify us as a key partner in the space of sexual reproductive health. When they need policy advice, or they just need young people who to be represented or to raise their voice when the action meetings, we are able to participate in these meetings. And on top of that, we have been able to also attract other partners and donors to support some of the other key thematic areas that we conduct as an organization. Yeah.
Great. And we're going to have time, I think, for one more question, maybe two. A question from Rodrigue was that they're interested in knowing how this activity will be used to influence policies on youth sexual and reproductive health and rights at the national level, and how it will help decision makers leverage on this for other national strategies and programs supporting youth sexual reproductive health and rights. So this is a big question. I'm actually going to ask this to Haji so that he can talk about how the relationship with Ghana Health Services has grown into a longer term relationship and built into some subnational changes to strategies. So Haji, over to you.
Thank you very much, Katie, and thank you to Gregory for asking this important question. This activity has, like I said, elevated the discourse about giving young people the opportunity to lead. And based on all that we have done over the past 2 years, young people are now finding spaces in Ghana Health Service annual review meetings, where young people are also given the opportunity to help review and ask questions about achievements of Ghana Health Service with regards to youth, adolescent and reproductive health services. Our regional conferences has pushed the discussions a little bit further. That had a lot of stakeholders to participate and to make great inputs in how to shape and listen to young people, what young people actually need. And so for the past 2 years, we've had and received a lot of other organizations, stakeholders, policymakers calling YARO to further make clarification and other policy direction, especially attitude of Ghana Health Service staff and what we can all do to reduce stigma and increase the confidence of young people visiting our health facilities. Thank you.
Thanks, Haji, and over to you, Kelly.
I just want to thank everyone for joining us. We were so happy to have so many participants. Thank you, Haje, Katie, Corey, Maggie, for your wonderful remarks. And to everybody here, please stay tuned. We'll be sending out the links to the tools used by the youth-led organizations and an interactive report that summarizes not only the findings you heard today, but even more learning and insights generated by these incredible youth-led partners. Thank you all, and we look forward to continue to work with you to advance youth-led social accountability.